Welcome to the Allegheny Health Network Esophageal Institute. This educational video has been developed to aid our patients to better understand the 24-hour pH study, also known as an impedance catheter. Acid reflux, otherwise known as GERD, is a condition in which acid or non-acid backs up from the stomach into the esophagus and even the throat, irritating the tissue. The 24-hour pH impedance monitoring is a unique catheter-based test that is able to measure the amount of acid that comes up from the stomach and can help in the diagnosis and treatment of GERD. The 24-hour pH catheter test can be performed in two ways, either in the office or during an endoscopy. If done in the office, a recent manometry must be completed so that measurements for catheter size and placement can be obtained. A trained nurse will begin by explaining the procedure. A lidocaine-based gel will be inserted into the nostril to aid in numbing the nasal area. Next, a Q-tip will be placed into the nostril. This helps to facilitate passage of the catheter. The catheter is then inserted into the nares. During the insertion, the nurse will ask that the chin is tilted down to the chest and that plain water is sipped. The catheter, once inserted, will be taped to the cheek and to the neck to keep it in place. The receiver will be reviewed with the patient so that symptoms, positional changes, and food and drink intake can be monitored throughout the duration of the test. The catheter will be worn for 24 hours and then can easily be removed at home. If testing is to be done during an endoscopy, our staff will meet with you prior to your procedure to review your information and answer any questions that you may have. The physician will perform your endoscopy with placement of the catheter immediately following, while you are sedated. The catheter is taped to the cheek and connected to the receiver that you will carry for 24 hours. Eating, drinking, lying down, and symptoms will be recorded by pressing corresponding buttons on the receiver. At the end of the study, the catheter will be removed either at home or in the office, and the receiver will need to be returned to the office. Because we are measuring acid, you will have to be off of acid medications such as Nexium, Prilosec, Protonix, and Dexilant for 7 to 10 days before the study. Acid medications such as Zantac, Carafate, Pepcid, Reglan, and Tagamet will need to be stopped 3 days prior to the study. No Tums, Mylanta, Rolates, or other over-the-counter antacids can be taken for 24 hours before the study. You can continue all your non-reflux medication normally. If you take a blood thinner, please ask your provider if you need to discontinue it. If the pH catheter is to be placed during a sedated endoscopy, you cannot eat or drink anything after midnight prior to the procedure. If the catheter is to be placed by our nurse in the office, you cannot eat or drink anything 4 hours prior to the procedure. During the test, we would like you to eat as normally as possible with few exceptions. Do not chew gum or eat hard candy or breath mints. Please do not sip on water or other liquids frequently throughout the day. Drink a glass and be done for a while. Make sure to chew your food thoroughly. If the catheter seems to be pulling while you are swallowing, hold pressure on the catheter just outside the nasal cavity. This will stabilize the catheter so that it does not move. Please note, some patients have discomfort in their nose and/or throat when they swallow or talk. This is normal. If the pain becomes severe, we ask that you please call the office. Understanding and using the buttons on the receiver is a key component to having an accurate and reliable study. Let us start with the foot buttons. It is important for us to know when you eat or drink anything, except plain water. When you have started to eat or drink, you will push the blue fork and spoon button. A fork and spoon will display on the receiver screen, letting you know that the meal is being recorded. Once you have finished your meal, you will push the same blue button to stop recording. It is also important to let us know when you make positional changes, such as lying down. For this study, lying down will be considered flat with one pillow. Do not press the button if you are sitting or sleeping in a semi-reclined position. When you lay flat, press the orange lying down button. When you get up from a lying down position, you will press the orange standing button. The figure displayed on the screen will show the status of the receiver after you press each button. The 3 green buttons numbered 1, 2, and 3 are your symptom buttons. Common symptoms are heartburn, chest pain, regurgitation, and difficulty swallowing. Your symptoms will be discussed with our staff prior to the start of your procedure. Each time you experience a symptom, you will push the green numbered button that has been assigned to that specific symptom. The diary button will allow you to notify our staff if you are experiencing symptoms not assigned to a green number button. For example, you're having nausea. but that symptom was not assigned to the number 1, 2, or 3 button, simply push the purple diary button and write the time and the symptom on your diary. The screen will remain darkened most of the time. In order to light the screen temporarily, simply press the purple light bulb button. During the testing period, you're encouraged to continue your normal diet and activities. You're not to shower or bath during the 24-hour testing period, since the receiver cannot get wet. A packet will be given to you when discharged from the office or hospital. Make sure to return the diary along with the receiver, even if you have not written anything on it. The diary will provide you with a list of your symptoms, along with an area to write in additional symptoms than those assigned by our staff. If you are using the diary, please include AM and PM next to the times. The testing period ends 24 hours after the start time. Our staff will write the start time on your diary so that you will know when the catheter can be removed. You may return to the office to have the catheter removed, or you have the option of removing the catheter yourself at home and returning the receiver, case, strap, and diary to the office. If you choose to remove the catheter at home, our staff will provide written instructions to make it straightforward and easy to understand, as it is a simple process. Once the 24-hour study is completed, you may resume your reflux medications. It will take approximately 2 weeks for our office to have your results. The receiver can be dropped off at select locations or returned by mail. If mailing the receiver, please make sure to wrap the receiver in bubble wrap and place it in a small postal box purchased from a post office. Make sure to enclose all parts of the receiver along with the diary. Please make sure to obtain a tracking number when mailing in case there is a problem with delivery. If you have any questions or concerns during the study, please contact our office at 412-359-4373.